Van Zant.
Here.
Hopper.
Here.
Webb.
Looks like we do have a quorum.
I don't like that. There wasn't anything for somebody.
Okay. Is there any items that anyone wants pulled out of the consent agenda?
Can I just make a statement?
Yes, ma'am.
The attorney's not here, you can do whatever you want.
That's true. November, the November minutes, and that could have been things that happened in October, it was a wild month.
You're talking about in quality?
Yes.
Yes. Yes, it was.
Wow.
Yep,
I mean, it just kind of kept on going and going and
yeah,
going.
it did. It was October and November, it was a very wild month.
Is that standard procedure to have somebody come up and have to sit at the nurse's station if they're prone to,
The
I guess, falls?
Absolutely for safety,
Okay,
100% for safety, yes, ma'am.
okay,
That way, especially with staffing, if we don't have enough, like, one-on-one all the time,
sure.
it keeps them safe, absolutely.
That's the first time I'd seen that, I just didn't know.
We had tried literally everything with that patient, so
There you go.
that was the safety thing that we decided.
Those are the people that you have fold towels and roll silverware
Correct. Yep.
in long-term care facilities because it keeps them occupied and gives them a task.
Sure.
So, same principle.
And I think that contraband was something new that I've never noticed before too.
Oh, it happens.
More than
I
what we
mean, I've
know
just
about.
never seen it noted, I have no doubt that it happens. Okay, that was it?
Well, I would like to make a motion that we approve the consent agenda, grouping items 1 through 9 together.
I will second.
If we could call for a vote at this time, please.
Lively.
Yes.
Ford.
Yes.
Van Zant.
Yes.
Hopper.
Yes.
Do we have any remarks by anyone in the audience? Looks like that's a negatory. Moving on to item number 10, the financial report.
Adrian?
Hi everyone, can you hear me okay?
Yes, ma'am.
Perfect. All right, I'm going to go over the December financial summary. The average daily census for December was 8.65. This is up 1 day from November and down 1 day from the year-to-date monthly average. The acute payer mix for December was 85% for Medicare and Medicare Managed Care, with the prior month being 85% as well. The swing bed payer mix for December was 98% for Medicare and 2% for Medicare Managed Care. The year-to-date for Medicare is 80% and Medicare Managed Care is 20%. The operating margin was a loss of $111,000, which is up $53,000 from November. The year-to-date operating margin was a loss of $435,000. A lot of that is due to that 2% Medicare Managed Care payer mix from this month. I was talking to Dennis about it, and we've noticed that for the last 6 months, that payer mix for Medicare Managed Care has really gone down compared to the first 6 months of the year. The net patient revenue was $1.37 million for the month, an increase of $165,000 from last month, and a decrease of $61,000 from the year-to-date monthly average. 340B revenue was $24,000 for December. Expenses were $14,000. Operating expenses were at $1.52 million, which is up $138,000 from prior month and $25,000 from the year-to-date monthly average. Patient days for December were at 268, which is up 37 days from November. Cash receipts for the month were at $1.41 million, a decrease of $184,000 from the year-to-date monthly average and a decrease of $638,000 from November. Cash disbursements were at $2.48 million for the month, and cash balance at December month end was $1.1 million, giving us about 24 days of cash on hand. For the clinic, the average visits per day were at 13, which is the highest they were all year. Year-to-date revenue for the clinic was $597,000. Operating expenses were $910,000, ending the year at a loss of $313,000. And that is what I have. You guys have any questions for me?
Anybody remember what the operating loss for the prior year
was,
For the clinic,
yeah.
do you have that? It's closer to 500.
I
I
can
was thinking it
pull it
was.
up.
It
I was
was.
thinking
Just a
it was
second.
a significant improvement.
Yeah.
The only reason I know this is because I was working on our MedPro insurance. Our total patients, I want to say last year was 1,700 for the clinic, and it's up to what we're at this year.
So our net loss last year was 453,000 compared to the 313 for this year, so quite a bit of improvement.
Yeah, that's great.
Yeah. Like I was saying, our clinic visits.
If you can call a loss great, but.
Well, profit would be a greater tragedy at this point, so.
True.
Yeah.
I'm beginning to think healthcare is much like the restaurant business. There is no such thing as profit.
Yeah, we were at 1,757 last year, and we were at 2,316 this year for total visits at the clinic, so we were up quite a bit.
Moving in the right direction.
Moving on to item number 11, discussion and possible action to approve master affiliation agreement between Oklahoma Baptist University and Mangum Regional Medical Center.
So OBU is starting a PA program, and they are sending out affiliate agreements to all area hospitals, including down here, that their people could do clinicals at. They have to have these to even start their program. If you notice, the agreement doesn't start till 2027 anyway. They already have to have them in place to get their program up and running. So that's what this is. This is so a PA student can come to our clinic and be with Dr. Sanda and learn from him, do clinicals with him.
So it will just be in the clinic,
The
not at the
agreement,
hospital at this point?
yep.
And this is strictly for Baptist, right? Not
This
for
is
any
strictly for
other
OBU.
Case, or, schools that you have to like find your own clinical.
Correct. This is strictly for OBU.
Well, I would make a motion that you approve it, or that we approve it.
We could call for a vote at this time.
Lively,
Yes.
Ford,
Yes.
Hopper,
Yes.
Van Zant.
Yes. Moving on to item number 12, discussion and possible action to approve Amerikai quote 37803 for a new access point for wireless connectivity, Port 53 Technologies.
So this is for a 3-year agreement, so even though it's a low cost of $270, it's a 36-month agreement because of the licensing. So we have to bring it to y'all. It is to provide an access point. It's already up. We've got a 30 days free monitoring. So we have a camera system, which is a new standard for, actually it's not a new standard, but for security and safety for the pharmacy. So they have a camera outside. Well, we weren't getting great connectivity from that camera with the access points we had, so we installed a new one, and it's worked great ever since. So they can pull up the cameras up all the time in the pharmacy, so they know who's outside the door at any time. The door's shut, locked, and we have to ring a doorbell or knock to be let into the pharmacy. It's just a security measure for us.
So this one is with Meraki,
Mm-hmm.
and they're just handling the cameras, or just that specific
Just that
camera?
access point. That comes from Port 53. It is just the access point. So anything on our wireless network can connect to that access point. We did not have an access point down the pharmacy hallway. This added one.
For example, if you were to come in for an EKG on one of the cubes that we have, sometimes it would connect and sometimes it wouldn't because the internet connection point wasn't close enough. So we would literally have to take it out to the hall further down to allow it to connect and send to upload.
Yep.
If that makes sense.
Yeah, it does, but like, wouldn't having like more routers or boosters?
That's what this is.
Okay,
That's exactly what this is.
okay.
That's what access point,
So you're
yeah.
just getting, the Meraki's just gonna boost the signal of what you already have?
Correct.
So,
Okay, so it's not like the Meraki system that I use?
Correct.
Okay, because I'm like,
No, it's just an access point.
Okay.
That is it.
okay, so they're just providing you this booster
Correct.
that you get to pay for.
Mhm.
Does the ISP not provide you guys boosters or not offer boosters?
Not enough.
Okay,
so I guess my question would be in regards to the second invoice on there, the quote for the MR licensing 3-year
Mhm.
agreement. What,
Well, are we gonna approve the first one first, because the second one's totally different section of the hospital?
Okay,
It's the IT stuff and how they get you. It's
Um,
nickel and dime here and then
Well,
a
well,
bigger quarter here.
the one cost of 270 and the 4,000 on the next, it's got me,
Yes,
kinda like,
there's a big, yeah.
so can we go ahead and hear about the big dog?
I can tell you about this one. So this is for a switch. This is from Meraki also. So the Meraki is the software that comes with the switch. So this switch allows us, again, all of our computers previously on the main patient hallway were all wireless. Well, they have taken that to hardwire. Increases, decreases vulnerability, increases speed, decreases the amount of lost communication with our computers that we're documenting on. Well, we did not have a switch big enough to hold all of those line drops. So this switch takes that place. It's a single switch and it's good for 3 years, and we'll be bringing another one back in 3 years to get a new switch and a new licensing agreement, I'm sure.
Yeah. Just, is there a reason to go with Meraki versus the ISP to try to get a better deal from your
That's
service
what-
provider?
That is what all of our security measures are through Port 53, so
Okay.
they all match.
Okay,
Yep.
gotcha.
I'd like to make a motion that we approve item number 12.
Is that where we're at? Yeah, I'll second.
Lively,
Yes.
Ford,
Yes.
Van Zant,
Yes.
Hopper.
Yes.
I'm more
Killed.
confused now. Okay, so we just approved
12.
item number 12, but there's Port 53 quote, and then under that, under item number 12, it says quote 37803 Mangum Regional Medical Center, the 3-year licensing. And
Mhm.
that was the,
You get a 3-year license with both of them,
okay,
with the access point and the switch.
cool. Okay, well, I'd like to make a motion that we approve item number 13.
I will second that.
Lively,
Yes.
Ford,
Yes.
Van Zant,
Yes.
Hopper.
Yes.
Okay, just moving on to item number 14, discussion and possible action to approve amendment number 3 on the 340B contract pharmacy service agreement with Puckett Discount Drug.
So this is only amending, previously, it didn't say specifically that each one of us will carry 1 million, 3 million liability insurance. Now, if you look at the agreement, the addendum that they're gonna have to sign with us, it specifically says insurance. We both will carry the 1 million, 3 million. Just specific wording.
Is that something 340B is making us do, or is it just an open vulnerability?
It's probably a vulnerability. I don't know if they're making us. It's just our contract, 340B compliance consultants that review all of our policies saw that we were missing that and felt like it needed to be put into our policy.
Okay.
I would make a motion that we approve this item.
I would like to second that motion. We can call for
Lively,
vote.
Yes.
Ford,
Yes.
Van Zant,
Yes.
Hopper.
Yes.
Okay, moving on to item number 15, discussion and possible action to approve the MRMC 2026 budget.
Okay, I'm gonna go over a couple of the assumptions for the 2026 budget. We have the average daily census is a 9.83. No payer mix changes really. Calendar days are the same. Business days are at 250. We didn't have any shop or Sooner Select increases because we didn't have it from them. I think even as of today, Dennis, we still didn't have the updated numbers, but we should be receiving our first payment for 2026 in the next week. We have ER visits as budgeted for 4.73 per day. Other visits at 4.66. RHC visits, we have a 15% increase, which gets us to 12 per day. Along with that, our 340B revenue and expenses are also have a 15% increase. We did a 3% salary adjustment for all employees, and then we budgeted for 3 more strong mind patients for 2026. I will hit the high points off the accrual and cash-based budget slides as well. Total operating revenue we've budgeted for 2026 is $17,902,000. That's an increase of $381,000 from prior year. For the accrual basis, the expenses are $17.7 million, which is an increase of $245,000, giving us a net income for the year of, where did it go? Sorry, a loss of $218,000, which is $135,000 increased from 2025. The cash basis, the difference is the expenses is $17.5 million, which of course with the cash basis you end with a net income or loss of $0. So that is what I have. If you guys have any questions, just let us know.
I don't have any questions.
My budget is just a plan, so
Mm-hmm.
I will make a motion to approve.
Well, before you do, there was one thing that I was like, for years we couldn't have a budget because, or put something down like this because we can't pass a budget where we're gonna lose money, I thought, in terms of the city. Do you remember that, Cheryl, or am I completely making things up?
The cash basis budget would have a 0 on it.
Okay,
if
is
you
that
look at
what
the
we
very
did?
bottom.
Okay,
Mhm.
cool. So that's how we're getting around that. Okay,
Yes.
okay. Just felt nervous without an attorney in the room.
Understand.
But an accountant is just as good. So,
Depending on the charge.
yeah, that's true. I don't know. Okay. I'll make a motion that we approve it.
Second.
We could call for a vote.
Lively,
Yes.
Ford,
Yes.
Van Zant,
Abstain.
You made a motion, you can't. I'm gonna be Corey right now. You
Then
can't
yes,
do that.
I approve it.
Hopper,
Yes.
No fun. Number 16, discussion and possible action to approve Megan Smith as MRMC infection specialist.
So she's the infection preventionist for the facility. We just have to put it on paper that y'all have approved that she is the infection preventionist. She has currently been the infection preventionist for 2 years now.
Is this the lady that was at my office?
Yes.
Okay, she's amazing, so.
Yep. She was at the water presentation. Yes, ma'am.
she's
I'll make a motion to approve.
I'll second it, sorry.
We could call for a vote?
Lively,
Yes.
Ford,
Yes.
Van Zant,
Yes.
Hopper.
Yes.
Moving on to item number 17, discussion and possible action to approve Mark Chapman as MRMC safety officer.
Again, he's been the safety officer for
I'll make that motion.
probably 8 years.
And I'll second that motion. We could call for a vote at this time, please?
Lively,
Yes.
Ford,
Yes.
Van Zant,
Yes.
Hopper.
No, yes, I'm just kidding.
I thought about doing the same thing on the safety, on the infection preventionist, but I thought, man, the last thing I want to do is go in the hospital and have veto that lady. So,
Yeah, it's just Mark. He'll be like, I'm surprised she didn't say no and just keep it that way.
exactly. Mark would be way too happy if we vetoed that. So.
Yes.
Yeah, he
I
would.
not be.
That's why you gotta say yes.
Yeah, I know. I guess moving on to item number 18, discussion regarding the big beautiful bill.
That's gonna be business.
It's gonna be great, I know it is.
Dennis, do you want to discuss the one big beautiful bill?
Yeah, I sure will. Good evening, everyone. Hopefully you can hear me okay, but if you can't, please feel free to speak up.
You're coming in crystal clear.
Good deal. And before I forget, I just wanted to applaud, they do a really good job at these budgets and budgeting them at the departmental level. So Kelly and Adrian and all the team, they really worked hard and put together a good product, and I think it's conservative. I think the hospital has been at the best financial position as it's been since I can recall, so I'm glad to see things going that way. But everybody on that team's worked really hard. Short version is that right now, everything's uncertain, so it's a speculation. And when you get out to the outlying years and you're speculating, I mean, it's hard enough to get 1 year, let alone several years out. But so the numbers that I'm going to read are basically quotes, but you should have that in front of you. And we tried to put together 2 pages and just a synopsis. So the projection is that Medicaid cuts to rural Oklahoma are going to be over $5 million. And it's projected that most of those will start 10 years, and they'll be over 10 years. But they won't begin until 2029. And again, no one really knows what areas that will hit, but the biggest concern and the things we always worry about is that reduced Medicaid coverage. You know, that those are the areas that get hit and less people qualify. So that's where the numbers come from. Now, in order to help mitigate part of that, and I say part because it's only about 20%, even beginning this year, they put into effect a federal, the Rural Health Transformation Program, RHTP, which is $50 billion from the federal government over the next 5 years. Oklahoma is projected to get, is getting $223 million this year, and they're projected to get about $1.1 million over the next 5 years. And there's a list of the allocation by states on the next page. So you can see that they got their fair share. But again, that's only about 20% of what's projected to begin going away in 2029. And then the last piece that I'll say, and you can read for yourself, is there are no specific actions for our hospitals to take currently. And so again, we don't have a projected monetary impact. The funding allocations, again, we only know what the amounts are, but we don't know where they're going or the resources. So we will continue to follow up. We'll continue to monitor this every week. I'm in contact with OHA. There's a lot of other members on this call and this team that are in contact with their respective representatives as well throughout Oklahoma. And we will continue to stay on top of that and update all of our boards as soon as more information becomes available. I'll try to answer if there's any questions that someone has, but again, these are speculations. And again, 5 years or over 4 years out.
I do you know about the meeting February the 11th in Altus that's going to actually cover this big, beautiful bill?
Yes.
Okay.
Yes. Moving on. I'd like to make a motion that we enter into executive session.
I will second that.
We can call for a vote at this time.
Lively,
Yes.
Ford,
Yes.
Van Zant,
Yes.
Hopper.
Yes.
Can we just stay right here? Is there any reason to leave? We just turn
I
it off?
would need
Camera
to
and
leave.
stuff, I think,
Yeah.
right?
Okay.
Yeah, the camera's on and all that.
Well, I have to pause it when you guys leave anyways.
Just turn it off and leave it off. No. Motion still carries. Okay,
He just had to get it out of his system.
I did. Moving on, do we take a vote now to approve?
Mhm.
I'd like to make a motion that we approve.
We do both, I think.
All the credentialing and re-credentialing.
Where it's let us before.
Okay. Whatever he said.
I'll second the motion.
We could call for a vote.
Lively,
Yes.
Ford,
Yes.
Van Zant,
Yes.
Hopper.
Yes.
Okay, I'd like to make a motion that we enter back into executive session. Oh, no.
Yeah. Okay, we just did 20, excuse me, my bad.
Or open, yeah, discussion.
Open session about,
So it'd
in
be
regards,
21.
no action needed on 20. 21, I'd like to make a motion that we enter into executive session.
I will second.
Yes.
Lively,
Yes.
Ford,
Yes.
Van Zant,
Yes.
Hopper.
Yes.
Are we doing this again?
Yeah.
No, how many times after?
The boats just about made it fall over.
That actually would have been funny.
It'd been funny if it had been on camera.
It would have been.
Oh, it would have been on camera, yeah.
Is it on?
It is
No.
on.
You about face planted my computer.
Yes, I did too. And it was all the boots. We'll never wear snow boots again. I don't care how much snow we get.
I'll make a motion that we exit out of executive session.
I'll second it.
We can call for a vote.
Lively,
Yes.
Ford,
Yes.
Van Sant,
Yes.
Hopper.
Yes.
Okay.
It's no action, right?
No action.
Yeah,
Yeah.
there's nothing there.
Staff and board remarks.
I don't know if this is the right time to say this, but I would just like to commend y'all on what you've been doing for the community. I know you did lots of dinners and things in December. You had the toy drive. I saw where the cafeteria was open a couple of days or maybe every day.
Breakfast and lunch.
So, I know when I first moved here, a lot of people used to go to the cafeteria, but I don't, you know.
So they started that first of January. We have so far this month, I think she told me yesterday, tripled any month we've had in a month, so. So, yeah,
And is-
there's days we have
But you still have to call for your lunch.
by 11, yeah,
Okay.
yeah, just by 11, just so they can have it prepared.
Is the salad bar good there?
The salad bar's good there, absolutely.
Thank you.
The
Uh-oh.
Does
club
that
is
one, do you
amazing.
get to go and do your own
Oh,
salad
yeah,
bar?
yeah, absolutely.
Cause I love salad bars and I saw that and I was like, I'm gonna go eat at the hospital
clubs are
every day.
amazing, hamburgers are good, the fries are good, they do a club wrap that's really good, so, yeah. Or
Everything
you
I've
can
heard
have
was
a patient
positive
wrap.
on the food as far as what's open to the public. It was all positive so far.
When you get a burger and
Yeah.
fries for $7.
Yeah.
So, a couple things I would like to say is recently I've had several people reach out to me and say how unbelievable the care was, that they didn't know how amazing the staff was at Mangum Regional. I've heard this multiple times. I have never heard so much praise about a hospital than I'm currently hearing. And it is absolutely amazing. Just now, I received a text message from Michelle Huckabee, our city council lady, commissioner, who said, please tell Mangum Regional Medical Center, thank you. I was well taken care of today. It is so incredibly refreshing to get these positive comments and feedback and just thank you. I know you guys are just working tirelessly to take care of the people of this town, and it is fully being recognized by the community. So thank you, because you must be doing truly amazing.
I can add to that, my dad was out there for 11 days, and, he got the best of care.
Thank you.
And every minute, and he wasn't always an easy patient to take care of, but he was in pretty bad shape when we took him out there, and he really got taken care of well, so I was very happy there. There are some things that I wish you that you could get better
Mhm.
equipment, I mean, furniture, like
Yes.
those chairs out there, I could hardly lift, they're completely
Mhm.
manual reclining
Yep.
things, but I understand
Yeah.
where you're at, and you can't, but I think you're doing an amazing job
Well,
with
thank you,
what you've got
we
to deal
work
with out there.
tirelessly to try to keep the patients in number one.
Yeah.
And that's what we really preach to all the staff, the patients the first thing.
And when you talk to people around town who might compare this place to another place, and I don't think it was because I'm a board member, but these people are accessible. You see them in the hall. Our nurse was right next door. You can go directly and solve a problem if you have one. We didn't really have one, but you can, and you don't get that in a bigger hospital at all.
I don't know.
Appreciate that.
That's an advantage that people should realize.
And it's incredible to say, listen, if you need long-term medical care at a hospital, Mangum Regional Medical Center, I don't care where you are, is the best. And that's so cool to get to say, and just thank you for making us as the board look good. So, because we know it's solely on you guys, so thank you. You're doing amazing. And thank you to all your staff out there.
We'll let them know for sure.
So, is there any new business? Okay. I'd like to make a motion that we adjourn.
On the second?
Lively,
Yes.
Ford,
Yes.
Van Sant,
Yes.
Hopper.
Yes.
Awesome.
All right, thank you, guys.
Thanks for coming,
Just
Corey.
in time.
Corey showed up just in time.
I was gonna say when he said new business, yeah, Corey's here.
Yeah.